Thank you. So our next speaker is Amy Farmer. So Amy is joining us from the American Association of Veterinary State Boards and going to talk about PAVE and evaluated clinical experience. Thanks.
Yeah, sure. Thanks, Linda. So just a quick, what is the AAVSB? So we're the American Association of Veterinary State Boards. Our membership are the 63 licensing boards in North America, so Canada, the United States, and our provinces. So what I'd like to share with you today is a very high-level overview of our PAVE program, which is our pathway for internationally trained veterinarians to become licensed in North America. So we're expanding veterinary talent pathways. So clinics across North America are feeling the workforce strain, much like here in Europe, I would assume. Workforce strain? Yes. Rising pet ownership, growing demand for urgent and specialty care, and the needs of rural and food animal sectors are creating chronic shortages across the country. Internationally trained veterinarians, they represent one of the most promising sources of qualified talent. So we want to create pathways that will take advantage of that. So PAVE stands for the Program for Assessment of Veterinary Education Equivalents. It's operated by us, the AAVSB, and it provides a standardized, rigorous method for evaluating whether graduates of non-AVMA accredited international veterinary schools meet the educational foundation necessary to practice in the United States and Canada. Regulators rely on PAVE because it's defensible, consistent, and grounded in both psychometrics and professional standards. So PAVE is accepted by most US states. There are 5 that do not accept the PAVE program. Those 5 states are statutorily unable to accept the program. When Lindsay talked about being able to make some changes in whether or not we are very reluctant to open up our practice acts in the United States because of all the things that could get tacked onto it. So for candidates, though, this means that increased mobility, and for regulators, it means confidence, and for employers, it's a broader talent pool. So candidates begin by submitting documentation. They need to verify their veterinary degrees, their English proficiency, and credential evaluation materials. So eligibility ensures that the candidate's background aligns with the standard expectations of the AVMA COE accredited schools. The qualifying science exam, or commonly called the QSE, is a 220-minute computer-based exam with 225 questions. It's designed to assess foundational basic science knowledge covered in the first 3 years of veterinary school. It's offered at testing centers as well as live remote proctor 3 different times a year. So questions are developed and reviewed by veterinarians and psychometric experts. It covers 6 major domains from anatomy and physiology to therapeutic and public health. There's a strict retake policy to ensure exam integrity. In addition to passing the QSE, candidates must demonstrate clinical competency through a clinical rotation or 4th year at an AVMA COE accredited veterinary college, teaching hospital and model. So this hands-on requirement ensures that graduates can translate theoretical knowledge into practical clinical settings, giving candidates exposure to US and Canadian standards of care, communication expectations, and clinical reasoning. So faculty, practitioners, they provide direct evaluation to ensure competence. So after successfully completing the QSE and the ECE, candidates are issued a PAVE certificate, but this is not a license. This is just a certificate that says they may go on and pass the NAVLE and meet the jurisdiction-specific steps, but it verifies that their foundational education is equivalent and prepares them for final jurisdiction final licensure in their jurisdiction of choice. So the value of PAVE is threefold. It strengthens the veterinary workforce during this time of critical shortage by expanding the pool of qualified veterinarians available to serve communities experiencing a veterinary shortage. It provides fair, accessible, and a rigorous route for international veterinarians seeking to gain licensure in North America. It helps regulators ensure public and animal safety through validated competency assessment. We acknowledge, though, that there are challenges. The clinical rotation capacity is a significant one. Differences in global training models and varied state requirements. But PAVE's structure helps address these by providing standardized expectations, a defensible exam, and a rigorous competency validation. So the veterinary workforce crisis requires immediate and scalable solutions. The PAVE certified candidates are prepared to enter the workforce within 2 years of beginning the certification program. The demand for veterinarians continues to rise much faster than supply. International graduates, when supported through programs like PAVE, will help fill important gaps, particularly in underserved areas. PAVE helps build that bridge in a structured and dependable way. But it takes all of us. Not a single program is going to make this happen. So the veterinary community plays a vital role in supporting PAVE candidates. Veterinary professionals can support PAVE candidates by offering mentorship, encouraging clinical externships, providing supervised training, and advocating for clear state licensure processes. Your support helps high-quality veterinarians enter practice and meet community needs. So while PAVE currently has a rigorous pathway, we recognize that it doesn't fully support the scalability that it needs to. The AAVSB is prioritizing the development of alternatives for the PAVE program in 26 and 27. We are creating a task force that will be charged with thinking outside of the box. Low-hanging fruit for this task force is to educate and encourage all AVMA accredited schools to accept PAVE students in that fourth-year rotation. This effort is already underway with Seoul National University, and they will begin accepting PAVE students in 2026. Utilizing distributive models that will allow candidates to experience the ECE outside of a teaching hospital is also underway. More complicated solutions are performance assessments that will evaluate a candidate's area of competency and identify gap areas, allowing them to only complete additional testing in specific areas. Virtual reality and simulation-based exams are also improving every day and are becoming more feasible for programs such as PAVE. So in summary, PAVE is an essential pathway that expands access to qualified veterinarians, strengthens the workforce, and supports the mission of protecting the public. Animal health and looking to the future for what is next and the best process for increasing veterinary mobility. That is our high-level 30,000-foot view of what the PAVE program is. So do you have any questions specifically about this program before we move into a conversation on workforce mobility or any other topic that you might want to address with our panel?